Hello, my name is Alyssa Lambrecht, and I grew up in a suburb of Toledo, Ohio. My neighborhood was safe, and I had two healthy parents. I was sheltered from the harsh realities many people in my area face just by the zip code I grew up in. I was raised around the rhetoric that anyone who used drugs had chosen to do that and were deserving of any consequences that developed because of that choice. I didn't have the words or knowledge to understand what I could do to break down the stigma that was prevalent in my community, but the seeds were planted that this was a population that needed increased social support. It wasn't until my first rotation in my third year of medical school that I began to understand and learn about addiction and how medical professionals and community members contribute to the stigma that these patients face. Within 1 week of my addiction psychiatry rotation, I heard stories of illness, struggle, and hard fought recoveries that I had never been exposed to before. After 4 weeks of attending AA meetings and interviewing patients, I left with a greater empathy for these patients and was eager to use my new skills and understanding in other rotations. I was disheartened within the first week of my second rotation on internal medicine when I heard the way these patients with substance use disorders were spoken about by other medical professionals. I heard comments like addicts and I will not give in to people like this and there's nothing we can do for them anyway. These patients were written off without any further questioning, and proper medical care was not provided to many of these patients due to the stigma surrounding substance use disorders. As a medical student out in the clinical environment for the first time, I did not know what I could do when I heard comments like this. At first, I didn't have the knowledge of the way that these patients should be spoken about. I just knew that they weren't getting talked about in the way that they deserved, and they were not being treated as human. It often feels that our voice as students is small compared to the people that have positions above us, and it was scary for me to speak out. Thankfully, the Copello Fellowship allowed me to develop my skills to be more comfortable advocating for patients in these situations. I knew that there was a problem in medicine and in our society surrounding the stigma of patients with addiction, but how could I help? Through the fellowship, we learned about how to identify allies in the field and network with people who may be interested in helping us. So, the first place that I found a network was through my own medical school. I felt that I didn't have the proper knowledge I needed to be able to stand up confidently when preceptors spoke about patients in a negative manner. I asked if we could develop a program that would help increase awareness of how patients should be discussed when talking about addiction and substance use disorders. Using the correct language is the first step in breaking down stigma. With the help of two faculty members, we were able to develop a workshop that had between 20 and 30 students participating in case discussions that allowed us to further explore the complex issues surrounding substance use and specifically racial disparities in treatment. After I had developed this workshop, I continued to use the skills I developed in the fellowship by sharing my story, recruiting other allies in the field, and furthering my advocacy efforts through my Copello Fellowship project. I wanted to create a series of videos and a toolkit that would provide medical professionals of all levels of training the skills to have difficult conversations and teach the importance of understanding addiction medicine and how providing non-stigmatizing care can lead to better outcomes for all of our patients. I interviewed a variety of specialists from across the country, some of which I had reached out to on Twitter and had no prior contact. Some were members of the Doctors for America family, and others were from organizations such as the Drug Policy Alliance and utilizing resources such as the Substance Abuse and Mental Health Administration Services. And by becoming this Substance Use Disorder Subcommittee Chair for the Community and Health and Prevention Committee for Doctors for America. When I was first asked, I thought to myself that I didn't have any of the skills needed to be able to chair a committee like this. But with the Copello Fellowship, the seeds of leadership and advocacy were planted, and I was able to develop into a better leader because of these skills. By creating the resources I did, I hope to plant the seeds in the minds of medical students that there is a better way that we can serve patients with a past history or current history of substance use. With 1 in every 8 adults struggling with alcohol or other substance use, our patients need all of us to learn more about providing life-saving care. By fostering personal and professional development activities surrounding substance use disorders, we can create a positive environment that will optimize care for our patients and allow them a better chance at healing by becoming better providers who are more well-rounded and willing to help patients from all backgrounds.